We start our top story check in the Turks and Caicos. That's as hospital theirs are being stretched thin as they're seeing a 43% spike in admissions. And as our One Caribbean News' Deandra Hamilton reports, it has nothing to do with COVID-19 patients.
Turks and Caicos hospitals is experiencing a surge in admissions and people presenting to the facilities in Providenciales and Grand Turk for medical care. And while it is a strain to the system, CEO Dr. Denise Brathwaite-Tennant informed it has nothing to do with COVID-19.
We have seen activity through our emergency department of persons with acute upper respiratory type symptoms, and we have done home isolation and screening, and the majority of those persons have tested negative on PCR, suggesting that this is related to the seasonal viral that we currently have one patient who is stable. It was detected upon screening, and the symptoms are not directly related to COVID, and that patient is stable.
In an effort to bring understanding to the level of service the hospitals are managing, Dr. Brathwaite-Tennant shared that there has been a 43% increase in visits, and though there are contingencies, the regular capacity is 105% or over the availability in Providenciales and 80% in use in Grand Turk. She explained why.
And once persons, especially when the lockdown was released, they concomitantly saw an increase in patients coming to visit them, which was good for them, for their practice. It was good for us as well, because it allows us to also have a focus on the COVID-19 response, and it allows our patients also to get care within the community. We noticed that as the restrictions release, as the COVID numbers go down, we are seeing more and more persons visit our outpatient clinics for appointments.
The hospital struggled with finding staff, increasingly a challenge in the pandemic. But the Cuban Medical Brigade continues to offer the remedy, and having locally established oxygen capacity has been life-saving help.
We have the ability at both hospitals to generate our own oxygen, so we're in very good position in terms of that.